Well, I think in healthcare, it's a little bit different. I don't think everybody is willing to be told or to get their prognosis from a digital device, for example. And so, one of the challenges there is changing the game. Getting people to think differently about their healthcare and to think more proactively about their healthcare. And accordingly, we have to do the same.
Welcome to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators reimagining the future of health. I'm Logan Plaster. Today we're talking with Terry Booker, the VP of Corporate Development and Innovation at Independence Blue Cross. Booker combines years of experience in investment banking and business development with an insider's knowledge of Independence Blue Cross, an insurer that serves more than 7 million people. In our conversation, which was held in front of a live virtual audience of founders from the Startup Health portfolio, we get tactical about how startups can best partner with the largest insurers in the world. It was a great conversation full of Booker's candid wisdom. Stick around. Terry, it is our pleasure to have you on this fireside chat. Thank you for taking the time with us today.
Thank you for inviting me, Logan. Appreciate being here.
Let's start just by hearing a bit of your story. I want to know how you got into health innovation. I mean, there are simpler ways that you can make money in business development and in investment banking, less complicated ways than getting into healthcare. So what got you into healthcare innovation?
Sure. So about 11 years ago now, Independence Blue Cross was standing up a corporate development area. And I was brought in, I was a consultant at first, and then I was brought in-house to actually run the group. And then in 2014, Dan Hilferty, who was our CEO at the time, really took on an initiative along with a number of other people, Brian Lobley, Mike Venera, and a few others, to really focus on innovation. So we had been investing in a indirect way through a number of funds, actually in our pension fund, not with a strategic mindset in place. And that year the board decided that we would invest $50 million, 20 of that direct, 30 of that indirect, meaning that we would be with certain private equity and venture fund managers. And we're also a limited partner in the Blue Venture funds. So we've been in all 4 of their funds thus far. And in that process, we continue to look at companies and try to figure out the inorganic ways. And that's my group's role, to look at those inorganic things that might help us in the delivery of healthcare and to be more efficient as it relates to us being that intermediary between the providers and the patients/customers of healthcare. So that's kind of what gets me to where I am today.
Before I sort of move on, what do you mean by inorganic? Could you sort of drill down on that a little bit?
Well, organic stuff would, for us would be things that happen within the company. So there are lots of initiatives and efforts that happen within the company. So when we look at working with vendors, any of the folks that are out there today, I see David Weingart out there. And so we've seen Cecilia any number of times. And so trying to connect those things to the mission that we have for our customers. And in some cases, our customers, it can be a Medicaid patient, it can be a duals patient, it can be a Medicare Advantage patient. But in many cases, and most of those members are commercial customers. So we have companies that fund their benefits programs through us. And then we have individuals that are probably, whether they have an individual plan or whether they are a part of one of the government plans from the ACA that underwrite that. And so we're trying to figure out how to keep them all healthy and how to be proactive in the marketplace.
Awesome. Well, we're going to get into the details of really how you partner with startups. But before we do that, paint us a picture of Independence Blue Cross. Kind of pull back the curtain, help us understand this payer.
Sure. So Independence Blue Cross, and you'll see me, you won't see me do it, but we have what are called the FOC, the family of companies. So we've got about 25 to 30 companies, it depends on which week it is, that we do business literally all over the country. Most notably, we're Independence Blue Cross in the 5 counties of southeastern Pennsylvania. Those are the 5 most populous counties in the state. We also do business with a company called AmeriHealth Caritas, and that's in about 24 states across the country, and that's in Medicaid managed care. And then thirdly, we take that AmeriHealth brand and we do business in New Jersey and a number of other places, AmeriHealth New Jersey, and we have AmeriHealth Administrators, which is a third-party administration firm. Essentially, what we are is a $25 billion company. The margins, as many of you know, in insurance are somewhat razor thin. However, in the last year, we've seen a bit better margins because of the pandemic and the fact that people couldn't get to or go to hospitals. So our medical loss ratio was a good bit less. And so that's where, telemedicine exploded and a number of other things. And so while we didn't have the same surgery costs that we would have in any given year, we did have a lot more telemedicine charges. And, what we had to do then is really adapt to that digital aspect of the market. And I'll say to you, probably before the pandemic, we had some incredibly small portion of people that were getting telemedicine visits. And so we had to change a lot of policy to make sure that doctors could, in fact, care for folks via a digital experience.
Could you break that down for us a little bit more? What did that adaptation look like? That's a major movement for such a large organization.
Yeah, so it is. So for example, for IBC, we have, we base a lot of our care off of primary care physicians or PCPs. And so as a part of a person's PCP visit, we would normally anticipate and expect that a phone call back to that physician would in fact be covered within that visit, as opposed to now each and every incident of that digital experience is a claim. It's a telemedicine claim, whereas before we were having challenges kind of with our own practice, making that an acceptable process. So we had to change a lot of policies and claims rules within our system to allow folks to really focus on having telemedicine visits, and whether it be behavioral health or actual, telederm visits, you name it, we now cover that.
What did that process teach you about the culture of innovation within your organization? This idea that sort of your ability to change and how you change can be as important as that particular change in the moment.
Well, I think, to be frank, Logan, I think we are always fast followers. It's fairly complicated as it relates to systems, to change claims rules and things like that. So when you're changing one, you have to change it across a number of platforms for employers and for all kinds of folks. And as you can imagine, each employer, each program, each governmental program all have different rules. And so we tend not to get out in front of those rules. Excuse me. But I think, otherwise, we do see how those things, clearly we've all seen telemedicine for a while, even the folks from Teladoc and Livongo and many other people that you've probably seen out there had been to the company. And some of the things that we do happen through the Blue Cross Blue Shield Association. So as a part of that process, because we have to be able to cover members that happen to be across the country, not just in Philadelphia Metro, a lot of that process gets approved at the association level. So for example, one of the companies that we deal with there is MD Live, and it's not Teladoc. And there are many others that are out there that are, I think, equally as good, but we end up having that selected through our association. Hopefully that's an answer to your question.
Yeah, no, that helps. I mean, you have to balance this culture of innovation. I was just going to ask, how does such a large company think through the risk taking that's necessary to be innovative? I mean, here you are in an innovation position, and you have to balance this caution versus risk sort of scenario. How do you do that?
Well, I think in healthcare, it's a little bit different. I don't think everybody is willing to be told or to get their prognosis from a digital device, for example. And so some of the things are really more methodological in terms of when can you see a doctor, or how can you see a doctor? How can you have better access to a nutritionist? How can you do more proactive things when in fact, for many, many years, even decades, we've been much more reactive about our health. We typically don't go to the doctor when we're healthy to say, how do you make us better? We typically go to the doctor when something's wrong. And so I think, in many cases, people look to remediate that. And so, one of the challenges there is changing the game, getting people to think differently about their healthcare and to think more proactively about their healthcare. And accordingly, we have to do the same.
Mm.
But there's still tons and tons of people that will still, go to the doctor when they're sick. And so, part of that is, that innovation culture we see from a very, like a 10,000 foot view, what's happening. And the question is, how do you get that to change? Because I think that there are lots of things that existed. And let's just focus on telemedicine, for example. I mean, telemedicine has been around for a long time. We've had it for many of our customers for a long time. It just hasn't been something that was used until it was absolutely necessary that people used it that way.
Yeah.
So I think at some point, each individual has to figure out what the utilization is for them. I mean, you see, what is it, PayPax that does the prescriptions, online prescriptions in a package. I mean, for that person who doesn't feel like putting pills in a pill box, that seems like the order. So it all depends on the customer, and not
Yeah.
just the doctor, not just the provider.
Yeah, and clearly you're using your investment in health innovation companies as a way to kind of push forward. You mentioned a $50 million fund. I think that sort of kicked off this innovation
Sure.
side of the business, right? Let's get into the more details of kind of how you spend that money. Kind of, we can talk about kind of who you've invested in, but I think question number one, what are some of the business model trends that you are most excited about in terms of how you invest those funds?
Well, I think the ones that put, more, are better tools for providers. I think, customers will be all over the place in terms of their desire and ability to utilize some of the things that are out there that are innovative. And we do a good bit. For a number of years. We were a sponsor along with Penn Medicine in the Dream It Health Accelerators. So there were, I don't know, in the neighborhood of somewhere between 60 and 100 companies we saw, through that program and did a lot of work with. But I think when you look at it, fee for value is huge. And while it's not, across the whole market, and I think a lot of that still happens within the scheme of large academic medical centers and large IDNs who may have ulterior motives in terms of wanting to do the most efficient thing and the best thing and the most innovative thing at the time. I mean, all of these folks have very complicated infrastructures that are not easy to change. And so I think, I think we'd like to move faster, but there are a lot of people you got to get to go along.
Yeah. I find that first comment you made is interesting, really focusing on the provider experience. You said kind of with the assumption that the consumer attitudes are going to be all over the place. I wonder if you could speak to that. I'm sure there's folks on this call that are thinking through the different user bases of their product, and speak to the value of really understanding that provider user base.
Well, I think the provider user base, again, it depends. I mean, if we feel that most of the activity, most of a person's health activity should be directed by a primary care physician, and having someone to navigate you through the healthcare ecosystem, because as you've seen, a doctor at one hospital, a specialist at one hospital can be dramatically more or less expensive than a specialist at another hospital. And similarly, they may have different outcomes. And so having those tools available at the very ground level, with each PCP is really difficult, because some of them, are just doing meaningful use digital EMRs and things like that. So they might not know about, all of the things that I see on a daily basis. And quite frankly, when you look at somebody going to a teledoc or any telemedicine venue, one of the things that had to happen for many of these independent physicians is for them to be able to offer those services and not have to kind of push them off to some other entity. Like, I'm just using teledoc just because it's an easy name to use, everybody.
Sure.
But what that doctor would like to do is that doctor would like to have that appointment him or herself, because when you go to somebody else, they don't get that fee for service, that fee for service revenue. And so many of the independent physicians are still fee for service physicians, and that's how they get paid. And so you have to kind of, look at all these things and say, well, how do we, provide those same tools so that we can provide a high level of efficiency and a high level of outcomes to each and every patient, not just some patients who happen to be, their doctor happens to be with the large AMC or IDN.
I'm assuming that you look at a lot of startups, a lot of health innovation companies. You have to sort of spot these trends, assuming that a cohort of them kind of fall into the right top level themes that you've just mentioned. What are some of the secondary traits that you find yourself looking for, whether it's in the executive team, whether it's in the business model, how the team thinks, et cetera?
I think, for me, the first question I ask is who's going to pay for this? So whether it's somebody like us as an insurer, one of the things that you always have to think about with an insurance company, at least in Pennsylvania, is that there's no corporate practice of medicine. So we stop just short of the line of telling one of our members exactly what to do. We will say, you should call the doctor. We just won't call the doctor for you. And so, so kind of breaching that gap, I mean, that's a legal issue for us, but breaching that gap. And so when you look at the folks on the provider side, again, how is that person going to integrate with your service? So let's just say that you're on palliative care. How does that doctor hand off that patient to a palliative care physician at those later stages of that person's life? So those handoffs, there are many of them in healthcare, in terms of how do you handle those and how do you make sure that people are being handed off to the right person? How do you make sure that each patient has some visibility about what's going to happen to them or about what can happen to them? And likewise, once they have that visibility, is there somebody that can navigate them? Do this, not that. This is going to be shorter. This is going to eliminate some of your frustration. I think we all have a lot of that.
Yeah. I mean, one thing I'm hearing in your answer is that a startup needs to think through the full care journey, the patient journey, and not just have their sort of micro view of their problem.
And we get a lot of folks who do have the micro view that, hey, this is a $10 billion area. And often it might be a $10 billion area, but we just don't see it that way because it's a part of an overall process that may have begun 10 steps before. So we can't pull that process out. Some other participant in the only way that we pull it out is unfortunately by either approving a claim or denying a claim. And the fact is that, that member should know whether that's a part of their benefit design as they go through the process. So we should go through a lot fewer denied claims from just from a customer service and a net promoter score perspective than people kind of doing things and then finding out it's not being paid for or that they went to an out-of-network doctor. All of these things that I know as just a person who's in the industry, most people don't know. And it's a tremendous source of abrasion and frustration.
Got it. That makes sense. I know a lot of folks on this call are sort of working on validation and understanding what kind of validation is going to be helpful for individual partners. So I wonder if you could give any wisdom around sort of the health economic data that stands out to you as sort of necessary lines in the sand. I mean, you could be talking about FDA clearance and where you're on in that pipeline. You could be talking about sort of the size of the trials that you've done. Are there some numbers that you sort of think about and that stick out to you?
Logan, actually, no. I mean, for certain things, like, there was a product that we looked at a couple of years ago that basically it was like an airbag for the elderly that if they fell over, it had, whatever's in an iPhone that says, uh-oh, you're falling. We need to kind of put off this airbag to keep people from injuring their hips. Okay, but something like that needs FDA approval. A lot of the things that are out there today in terms of applications for smartphone use, et cetera, really need some FDA approval. So, that's on one side. The trials actually don't need, tons and tons of numbers for services. I think part of it is really to, again, think through that continuum and say, well, how can I partner up with, a PCP? And some of the stuff doesn't happen over a month-long period. It probably happens over 6 months to a year. And you say, I think somebody asked the question about diabetes and a bunch of other things. Well, A, that you can evaluate that person. B, you can suggest to that person that they engage in, a diabetes management service or tool or whatever. And then do they stick to it? Does it actually allow them to lower their A1C? And, do they then kind of measure that outcome and so on? Those are the things that have to happen, and they don't happen quickly. And often what ends up happening is folks come to us and say, don't you have a population that you want to do this with? And the answer is probably, but that's a lot of work for us to do. And so that might not be the priority issue. So you may spend some time waiting, unfortunately.
What comes to my mind, just to sort of seed the insight period, is just your comments about the feedback loop. You talked about a positive collaboration with a payer, really needing to have an understanding of how is this changing the dynamic for my partner, and not just sort of hyper focused on your own product and your own product journey, but understanding the full patient journey, understanding the sort of pain points that your collaborator is working through.
Yeah. And Logan, I think that is there. Just the, often we have companies come in. We had a couple of the large pharma companies come in and talk about patient journeys for cancer, let's say. And some of that stuff is it's really a journey of where you will intervene with certain tools. So the journey shouldn't be so much different based on whether I'm taking a Bristol Myers product or whether I'm taking a Forest Labs product or whomever, so it should really, it should really avail me of the best brain power available at that particular time. And it should also be sensitive. And so, often I find that folks haven't mapped that out. I mean, literally a pictorial map to say, well, this is what we understand the patient journey to be. And so at some point we could say, oh no, that part right there, step 3 doesn't actually occur, or step 3 should be step 8. And so that helps to kind of at least create a good foundation for us collectively evaluating that problem or that product that an entity, has. I think, what I've seen is, I don't know, and this is where I get a bit provocative. I don't know that each day a person wakes up and really, cares about their health in the way that we think they do. I think they care about their ability to remediate that health. Okay, and so they look to our insurance to help do that. But do we all do the things that we're supposed to do to stay healthy? And it's not until those things, something happens, your liver feels a certain way, you feel sluggish because of your diet, or you've been to the hospital a few times because you've been hypo or hyperglycemic. Those are the things that you have to say, really, I really want to live a great life, and I'm going to do these things. How can we, because it's cheaper for us to do it as well, how can we help you do that? We're not at that place yet. We're still at people kind of saying, I feel really horrible today. What is it? Oh, I have some chronic disease. And they, you find out that, and then you have to, determine, are you going to take the steps to remediate that? And a lot of that is personal.
And understanding that psyche is critical to being a problem solver. If you don't really understand where the patient's head is at, you can't build the solution for it. We're getting close to the top, and I want to ask you one last question. Here you've got a panel of about 36 founders from distinct health innovation companies. You've got a chance to give them a parting shot, a parting piece of advice about their work and sort of their journey. What would you say to them?
I would say, understand who's going to pay for your product or service. I mean, a lot of people think, they say, oh, well, you're going to pay for it. And I was like, no, I'm not. So, there's that element. But I think also to really understand where you sit in the patient journey in terms of a decision. And if you've got an idea of what that outcome could look like, or a way that you have been measuring the outcome, to be able to share that, I think will also kind of raise eyebrows and say, oh, well, maybe we should look more closely at this. So I see a lot less of the patient journey and a lot more of, hey, let's go to the big insurer because that big insurer represents 7 million members. And so, let's start there as opposed to lobbying on a one-off basis, the 7 million members. I mean, there are other things, if you know of a good physician IPA, maybe, those are people who would say, hey, we should use your service for all of our patients. I just read a news article, one just started in the suburban counties of Philadelphia. So there are subgroups that you can target as well, not just the insurer. And you can probably look at entities like, if any of you or many of you haven't reached out to somebody like Roy Rosen at Penn, at Penn Innovation, or, I can't remember who's at Temple these days. I think I had to think of who's at Jefferson in that role. But I think those are all good places to start, as well as us.
Awesome. Well, that takes us to the top of the hour. Wise words, Terry. We are privileged to have you as a part of this fireside chat. I speak for everybody when I say thank you for taking the time from your vacation in Martha's Vineyard, taking a little time away, and joining us and really pulling back the curtain on how Independence Blue Cross thinks about innovation and how startups can collaborate with big payers. So thank you. Thanks for listening to Startup Health Now. Startup Health invests in health transformers from around the world who are committed to achieving audacious health moonshots. If you want to learn how you can join this community of entrepreneurs, or if you want to connect with one of our 350 companies, go to startuphealth.com. If you'd like to learn how you can invest in our Health Moonshot Rolling Fund in collaboration with AngelList, go to healthmoonshots.com. Thanks for listening to Startup Health Now. We'll be back next week.